Thank you for joining us today. It's been a busy time here at the Illinois Chiropractic Society. Many of you know that they've been attempting to work through some workers' compensation reform. In fact, we sent out an alert earlier this month in regards to workers' compensation reform. They reintroduced that bill as Senate Bill 12, and today that bill was heard in Senate Executive Committee just actually a few minutes ago, and we just left there. And I will tell you that hopefully by the end of the week we'll have some tentatively good news to put out there in regards to the workers' compensation reform. We'll definitely keep you informed to that regard. Of course, as with anything legislative, the process is extremely fluid, and that's why we're here. We're here to make sure that your interests are protected and the interests of your patients are protected through the Capitol and through other legislative activities and divisions, departments down here in Springfield. So that's what we've been doing today. Today, though, I wanted to touch base in regards to a very, very hot topic and hopefully give you some tools to take you to the next level. One of the challenges that we've been facing both here in Illinois in conversations with large employer groups and with other interested healthcare provider key stakeholders, and also in Washington, as we work with the American Chiropractic Association in advancing Medicare reform to make sure that they include chiropractic physicians in their entirety with all of the services you provide. That's what we should be being reimbursed by Medicare. In fact, I find it incredibly ridiculous that you're required to perform an examination in order to get paid for the services that are covered, but they don't cover the examination, and that's just the tip of the iceberg. But as we begin to make these efforts in Washington, what we're hearing more often than not is a pointing to an OIG report that came out last October that really honed in on the documentation efforts of our doctors. And I will tell you, it's not good. And it definitely poses a challenge for us because it indicates that a lot of the services you're providing are not medically necessary. Well, you and I both know that that's just simply not true. In fact, it's quite the opposite. So instead, what's happening is, as we begin to craft out and look exactly at what the report nailed down, and despite all of its flaws, despite its statistical flaws, if you will, it actually points to another issue that we definitely have as a profession, and that's we have challenges with our documentation. And so today I just wanted to give you one quick pointer. Hopefully it will help you with your documentation and in getting paid, not just from Medicare, but also from standard insurance providers and work comp, as that's the topic of today. But really what it comes down to is outcomes assessment. If you are not taking your patients through a strong outcome assessments process, then that's the mistake. That's the challenge that we're going to face for years to come if we don't get this aligned up and taken care of quickly. So here's your quick nugget for today. A couple of different resources. One is the Clinical Application of Outcomes Assessment is actually a book. It's put out by Stephen Yeomans and is available to purchase. I think you can actually purchase it directly from Dr. Yeomans, and it might be available on Amazon. I would check that out. Another resource would be if you just jump out to outcomesassessment.org, and that's outcomesassessment.org, and those are two quality outcomes assessment tools that will assist you in moving forward in your documentation. And when you move forward in your documentation, we move forward as a profession, and all you're trying to do is really just document the overall medical necessity of the care that we already know that you're giving. We already know that the care is important, it's necessary. You prove it in your documentation. Your reimbursement rates are going to increase. The rate at which you're going to keep those funds and get paid from insurance companies is going to increase. It makes our efforts as we advocate for the profession as a whole, both with large employer groups in Washington and here stateside at the Capitol. It makes our job so much easier when our documentation just proves out what we know happens in your office. So jump on and hopefully grab yourself some tools and move forward with outcomes assessment. And we look forward to talking to you next week. Thank you.